Hello. Today we will talk about antiphospholipid syndrome, mnemonic, APLS. We will start with the definition. Antiphospholipid syndrome. It is a systemic acquired autoimmune thrombophilia through antiphospholipid antibodies directed against phospholipids or phospholipid-binding proteins. It can occur as a primary condition, or it can occur in the presence of systemic lupus erythematosus or another systemic autoimmune disease. It is characterized by APL. A. Arterial or venous thrombosis. Arterial thrombosis in the form of stroke, transient ischemic attack, myocardial ischemia, renal artery and vein thrombosis, distal extremity and visceral thrombosis. Venous thrombosis common in veins of in lower limb, thromboembolism, thrombophlebitis, and livedo reticularis. P. Persistent of serum antiphospholipid antibodies positive even if done after 12 weeks later. L. Loss of pregnancy. Before 10 weeks greater than or equal to 3 unexplained consecutive spontaneous pregnancy loss. During and after 10 weeks greater than or equal to 1 unexplained fetal death. Before 34 weeks greater than or equal to 1 preterm delivery due to severe preeclampsia or eclampsia or features consistent with placental insufficiency. Difference between antiphospholipid syndrome and antiphospholipid antibody. Antiphospholipid antibodies, following exposure to an infectious agent or rheumatic disease. Antiphospholipid syndrome required a second hit in presence of an antiphospholipid antibody. Second hit is smoking, oral contraception, hormone replacement therapy. Antiphospholipid antibodies are APLS, anticardiolipin antibody IgG or IgM, anti-beta-2 glycoprotein IgG or IgM, lupus anticoagulant, protein S and protein C. Anticardiolipin binds to beta-2 glycoprotein 1. That in turn binds to cardiolipin, activate coagulation cascade. Anti-beta-2 glycoprotein 1 binds to beta-2 glycoprotein 1 on phospholipid. Induces platelet aggregation, activation of prothrombinase and plasminogen activity. Lupus anticoagulant. Its name is a partial misnomer, as it is a prothrombotic antibody in vivo. In vivo, induced hypercoagulable state by activation of platelets, complement, and certain coagulation factors. In vitro, act as autoantibodies interfere with phospholipids utilized to induce in vitro coagulation resulting in prolonged APTT. Protein S and protein C are directed against the natural anticoagulant. Testing for them is not recommended. Pathogenesis of antiphospholipid syndrome results from a variety of antiphospholipid antibody, APLS, anticoagulant inactivation, procoagulant and complement activation, liable to atherosclerosis and neurological damage, syncatiotrophoblast differentiation inhibition. That is why thromboprophylaxis failed to prevent obstetric morbidity in 20% of cases. Frequency of living birth rate by type of antibody treated with thromboprophylaxis. Anticardiolipin 56%. Anti-beta-2 glycoprotein 48%. Lupus anticoagulant only 80%. Anticardiolipin plus anti-beta-2 glycoprotein only 43%. 3 antibodies 30%. Management of antiphospholipid syndrome, APLS. Aspirin, low dose, thromboprophylaxis for arterial thrombosis. Plaquenil, hydroxychloroquine, reduce the risk of thrombosis and improve pregnancy outcome. Low molecular weight heparin, thromboprophylaxis for venous thromboembolism. Statins, due to their protective effects on endothelium. Steroids only in case of systemic lupus with antiphospholipid syndrome, secondary antiphospholipid syndrome.